I can get rid of gynecomastia in just one day. So what are the 5 myths about the gynecomastia that is wrongly believed about the surgery? So the first myth is whether we can get rid of gynecomastia by going to gym. So this is a big myth because I do the surgeries very routinely, and I get many male young patients who are already going to gym but they are unable to get rid of gynecomastia even after 4 to 5 years of the gymming. Many of the patients, they are gym instructors. Many of them are into professional bodybuilding. They are going for the competitions. So believe me, you can get rid of the fat, but you cannot get rid of the gland. So you are doing a vigorous chest exercises or aerobic exercises or the cardiac exercises, you are taking balanced diet, zero carb diet, the keto diet, whatever, you can remove the fat. I am sure you can remove the fat but not the gland. So gland is the hard tissue which is just under the nipple around the areola, so that has to be removed surgically. So this is a very safe procedure, so don't worry. So you can go to gym, then you try, but ultimately you have to come to me for the gland removal. And second myth, the second most important myth is there are medicines for the treatment of gynecomastia. Again, there is no medicine, no creams, no ointments, no oil for the treatment of the gynecomastia. Don't fall prey to all these myths. So there is only one treatment in our books, in our plastic surgery or surgical books, that is the liposuction and the gland removal. That is a minimally invasive surgery. So don't waste your time on medicines or any hormonal blood test or ultrasounds or any treatment from any local doctors. Even the educated doctors don't go for any medical treatment. And the third myth is after the gynecomastia surgery my skin will become loose. Again, this is wrong. So there is a natural tendency for skin to retract back. So if you see a pregnant woman who after 9 months after the childbirth, the skin goes back in just 3 to 4 months. So there is a tendency of the skin to become tighter or the skin retraction. The only thing is I have to assess it before the surgery, what is the grade of gynecomastia. If you have lost massive weight, so there is a lot of loose skin, there are a lot of stretch marks on the skin, such skin is very difficult to retract back. And we have additional procedure in Kyra clinic. We have the body tight skin tightening. This is a very high-end technology for the skin tightening. So we do it along with the surgery of liposuction, gland removal. Then we do the skin tightening. Not in all cases. If you have grade 3 gynecomastia, you have a very loose skin, the tone of the skin is not good, you have lost a lot of weight, now your skin is very flabby. In such cases, we need some additional treatment for the skin tightening. But if your grade is very less, grade 1 or starting of the grade 2, there are no chances of the looseness of the skin. And I advise you before the surgery. If I have the doubt that skin will remain loose, then we can do the body tight skin tightening. And in extreme of the cases, you might have not seen the grade 4 gynecomastia, there is a lot of loose skin after massive weight loss. In such cases, we have to do the surgical procedure with the nipple graft or the movement of the nipple. That is another surgical procedure, but in that case there will be a lot of stitches. So don't worry for the skin looseness in the normal gynecomastia surgery. The skin will not remain loose. The next myth is the side effects of the surgery. So many patients, they don't come for the surgery fearing that the surgery is not safe. Believe me, it is a very safe procedure. If you are going on an air flight, that is more risky than going to a surgery. So you come to me. So we are getting many patients from all over world, from different states of India, many VIP clients, and I am doing this for almost 20 years now. and we have not faced any serious side effect. So you are totally safe. Ask your parents to talk to me. If they are not comfortable, I will convince them, because this is a very safe surgery and this is going to change your life, because your chest will be perfect in just 4 to 5 days, and you feel very manly and nothing to fear from the surgery. So there are no side effects of the surgery if your doctor is trained. There are no side effects of the surgery if we are using the advanced technologies. So there can be some side effects if you're going to a doctor who is not a plastic surgeon, who is not doing a lot many cases of gynecomastia, and who doesn't have the better technologies for the liposuction, a less experience in this surgery. But if you go to any trained plastic surgeon, so there are minimal or no side effects of this surgery, so don't fear from it. Go for the surgery. You have to get it done only once in your life, so choose your doctor wisely. And last myth is there can be recurrence of the gynecomastia even after the procedure. So this is a very big myth. I assure you the results of gynecomastia surgery are permanent. So it is due to hormonal imbalance during puberty for a brief period. So there is a gland and there is a fat since your teenage. So once it is removed now, after the surgery, we will show you the pictures, we will show you in the evening, this is your gland, this is your fat, it is removed permanently. This is not going to reoccur again. And last, I request you not to go for any medicines from your gym trainers. So they will always guide you certain exercise plan to get rid of the gynecomastia. They might advise you certain medicines, but that might contain steroids. So steroids are very harmful for your body in general, and the steroids are notorious to form the gland in your chest. So stay away from any medicines from your gym trainers. There is no medicines, there is no shortcut in the gym. If you are sure, then I challenge you, you go to gym for many years and then come to me. So if you come to me, I can get rid of gynecomastia in just 1 day. Thank you.